There's one view of us as biological creatures that we are determined by our genes, that what we see in our biology is somehow innately us because of who we were born to be. What that misses is that we grow up and develop. We grow up as children, we grow up as adults and continue. We interact constantly with the world in which we are engaged. That's the way in which our biology actually happens. We carry our history in our bodies. How could we not?
Living in America should be a ticket to good health. We have the highest gross national product in the world.
I'm very happy to finally have some of my cars in one location, some of them.
We spend $2 trillion per year on medical care. That's nearly half of all the health dollars spent in the world. But we've seen our statistics. We live shorter, often sicker lives than in any other industrialized country. We rank 30th in life expectancy.
Especially of economically developed countries, we are at the bottom of the list.
A higher percentage of our babies die in their first year of life than in Cuba, Slovenia, Estonia. How can this be? Is this just because 47 million of us have no health insurance?
Healthcare can deal with the diseases and illnesses, but a lack of healthcare is not the cause of illness and disease. It is like saying, since aspirin cures a fever, that the lack of aspirin must be the cause of the fever.
Or is it mostly because of our American diet and personal health behaviors?
Those behaviors themselves, in part, determined by economic status. And so our ability to avoid smoking and eat a healthy diet depends, in turn, on our access to income, education, and what we call the social determinants of health.
But wouldn't our genes trump social determinants of health?
Among twins who lived together until age 18, who basically grew up in the same households, so had at least a relatively similar exposure. If they diverged later in life, if one became professional and the other was working class, they ended up with different health status as adults. This is among identical twins.
Written into our bodies is a lifetime of experience, shaped by social conditions and policies that can determine who will be sicker, who will die sooner.
There are ways in which our society is organized that are bad for our health. And there's no doubt that we could reconfigure ourselves in ways that would benefit our health.
There are huge inequalities in the society. All this wealth is maldistributed.
Pet food, ice for the pets' water.
And I think that's in part why the US as a whole has relatively poor health amongst the rich countries, and why even the better off people are suffering. And we think that that is not inevitable.
Unnatural Causes. Is Inequality Making Us Sick? Coming to PBS 2008.
The biggest myth about racial ethnic disparities in infant mortality is that people think that this has to do with just socioeconomics, and that the disparities are really the consequences of racial difference in socioeconomic status. And it isn't that simple.
Infant mortality among white American women with a college degree or higher is about 4 deaths per 1,000 births. But among African American women with the same level of education, infant mortality is about 10 per 1,000 births, almost 3 times higher. In fact, African American mothers with a college degree have worse birth outcomes than white mothers without a high school education.
Think about this. We're talking about African American doctors, lawyers, and business executives, and they still have a higher infant mortality rate than non-Hispanic white women who never went to high school in the first place. So what I've been calling for is a rethinking of an old problem from a new perspective, and to really rethink racial and ethnic disparities in birth outcomes from the life course perspective. And simply put, the life course perspective posits that birth outcomes are the product of not simply the 9 months of pregnancy, but really the consequences of differential exposures across the life course of women of color. We know that racism is stressful, and we know that stress can impact on the health in many different ways. It creates this chronic wear and tear on your body's systems to adapt. It wears on the hormonal system, it wears on the immune inflammatory functions, it wears on your metabolic functions, and over time it creates an overload on all of these organs and systems so that they no longer function optimally.
Everyday racism is like gunning the engine of a car without ever letting up. In fact, people who've looked at blood pressures, measuring ambulatory blood pressures for white folks and black folks, young folks, see that the blood pressures might be the same during the day, but at night the white folks' blood pressures would drop, and the black folks' blood pressures would stay the same. And so it is. It's like gunning the engine of that car, just wearing it out without rest. And I think that the stresses of everyday racism are doing that.
And then if you were to carry that into the pregnancy, then that gets embedded in both the pregnancy physiology of the mother and the developmental biology of the child. We certainly have done a lot in terms of increasing access and utilization of prenatal care, especially amongst communities of color, and yet we've done very little to reduce prematurity rates. I think that the problem is that with prenatal care, you're trying to cram all these good things into less than 9 months of prenatal care, and then expecting everything to turn out all right in the end, and to expect prenatal care in less than 9 months to reverse all the cumulative disadvantages and iniquities that's being carried forth over a life course of differential exposures. Is probably expecting too much of prenatal care. So if we're serious about improving birth outcomes and reducing disparities, we got to start taking care of women before pregnancy. And I'm not just talking about that one visit 3 months preconceptionally, I'm talking about when she's a baby inside her mother's womb, and an infant and a child and an adolescent, and really taking care of women and families across their life course if we really want to do something about improving pregnancy outcomes.